Hello, welcome to this informative quick module that is going to address vitamin D levels, okay? We are continuing on with this theme of addressing the fact that vitamin D is possibly the most important nutrient you could take, yet it is also possibly one of the most misunderstood supplements that is available. And so what we're gonna do is I'm actually going to minimize myself and get myself out of the picture. And I want to show you this really important chart. And everything that we're going to be looking at comes from, let me show you this, Grassroots Health, okay? They are a nonprofit organization focused on researching and educating the public about nutrients. So they have a plethora of great information. You can check them out at grassrootshealth.net. Okay, now let's go back to this chart. So with this chart, I know this chart might look a little confusing and overwhelming at first. That's too big. Okay, so let me explain what this chart means. Along the top line, top across here is different levels of vitamin D, all the way from 6 all the way up to 68, okay? Now, this chart refers to blood levels of vitamin D as nanograms per milliliter, because it's one of the most common ways that you'll see blood levels expressed. Now, historically, vitamin D has been known as the strong bone vitamin, okay? You've probably heard that you have to have your vitamin D milk in order to have strong bones. And so this research, you know, basically that's the first thing that vitamin D was known for many, many, many decades ago. And it was basically a level of vitamin D in this range. If you can see the cursor, you know, kind of between 6 and 18 nanograms per milliliter has been shown to be sufficient to prevent rickets, right? Which is great. Okay, now that is old research and old understanding of vitamin D. What I want to show you is that there has been a plethora of information in the past 20 years or so about other benefits of vitamin D. And so I know this is fine print here, but if you look at the dates on some of these research articles, right? This one has to do with the epidemiology of cancer from 2007. This is another one, 2007. What else do we have here? Okay, another one from 2007. There's other, yeah, a lot from 2007, it looks like. So a lot of different, and this chart itself was only published in 2012. And what it shows is that when you look at the vitamin D levels up in this range, the research is showing that there is the potential to help prevent significant diseases. And so, for example, look at these diseases listed on the left-hand side of this chart, right? All cancers, specifically breast cancer, ovarian cancer, colon cancer, non-Hodgkin's lymphoma, diabetes, multiple sclerosis, heart attacks, kidney cancer. Basically, what this is showing is that there is data showing that if we have vitamin D levels up in this range, we can have a significant impact on reducing the incidence of major disease. So for example, this one here, if you can see the cursor on the screen, at a level of 34 nanograms per milliliter, it was shown to have a 30% reduction in the incidence of breast cancer. At a level of 52 let's say 50 nanograms per milliliter, it was shown to have an 83% reduction in the incidence of breast cancer, okay? So, I mean, if you just kind of mull over those numbers, that's powerful, okay? And then there's a bunch of other diseases that are shown to vitamin D to be important in preventing or fighting. Now, the other thing I want to show you is that if we scroll up here, okay, let's zoom out a little bit. Okay, this is a letter from scientists all over the world, okay? And they recommend that the optimal level of vitamin D is between 40 and 60 nanograms per milliliter, okay, 40 to 60. And this is literally a panel of brilliant scientists from all over the world. Check out this. There's probably at least 40 or 50 names on here. They're all PhDs and MDs from places like Austria and Greece and plenty here in the US, all over the world. and want you to see that this is not just, you know, something we're making up. Is there's a panel of experts that agree that we really should be shooting to have a vitamin D level between 40 and 60. Now, what I find frustrating is a lot of people will go and get their vitamin D level tested and they'll be somewhere in this range, like maybe 20, maybe 26, something like this. And their family doctor will say, oh yeah, you're good, because they're above this traditional rickets prevention level. Yet, if their doctor just understood that if we could get these vitamin D levels up into this range, there would be this significant impact on preventing serious disease. All right, guys, I hope that this has been valuable and informative for you. And stay tuned for our next module of important information.